A meniscal tear or rupture due to degradation or trauma may be surgically debrided when physical therapy is inappropriate. The inner two-thirds of the meniscus lack a rich supply of blood and cannot heal, necessitating arthroscopic surgery in which the torn region is trimmed away. Small incisions are made on the medial and lateral sides of the knee joint, and the joint is expanded by injection of a saline solution. An arthroscopic cannula investigates the injury, and the damaged region is removed. The saline solution is drained and the incisions are sutured.